This is Chicago's very own WGN News at 9.
And later, slowing the opioid addiction crisis one doctor at a time. We'll tell you about a different approach to patient care following surgery. That's later on the Medical Watch. On the Medical Watch, a new approach to stem the opioid addiction crisis. The U.S. makes up just 4% of the world's population, yet Americans consume up to 95% of the world's narcotic painkillers. In the midst of an opioid epidemic, how do we cut back? One plastic surgeon shares his strategy, significantly slashing the number of narcotics he prescribes.
With all surgery, there's going to be some level of discomfort.
From tummy tucks to breast implants to liposuction, the procedures range, and so does the degree of pain and discomfort.
That's what we were trained to do. And whether it was in medical school or residency, it was patients have pain, give them narcotics. Patients have more pain, give them more narcotics. And we relied on it.
And so many patients expect the pills.
They remember when they had their other surgeries done and their doctors give them 30, 60, 90 tablets with refills, or grandma had her knee replaced and she was on narcotics for 6 months. They're used to that, and that is the kind of accepted norm.
Not for plastic surgeon Dr. Lawrence Iteld. His practice of prescribing little to no opioid painkillers stems from personal experience.
It was when I had my wisdom teeth taken out as a medical student. I took a Vicodin and I got really sick from it. And then just said, I can't do this anymore, and took Advil and felt better than I had on the narcotics. So the question was, can I then extrapolate that to patients? Opioids work at different parts of the body, and we know that they work both in the brain, they work at the spinal level, and they also work further out towards the tissue level. But they're sloppy drugs, and they have a lot of side effects, and they don't treat some of these symptoms really well.
Symptoms like tightness, throbbing, and burning, common discomfort following many of the procedures Dr. Iteld routinely performs.
I kind of figured it would be very painful.
6 weeks ago, Amanda Pizzullo underwent breast augmentation, something she'd thought about having done for years.
I felt a little groggy, obviously, because of the anesthesia, but it just really felt like I had done like 100 push-ups, and that was really it. A little achy. Yeah, and just a little achy.
No narcotic pain pills necessary. Instead, Amanda took a combination of anti-inflammatories, muscle relaxant, and a medication to decrease nerve sensitivity. And during surgery, Dr. Iteld injected a numbing agent to keep her more comfortable during the first 48 to 72 hours post-surgery.
So really, other than plain Tylenol, patients are rarely requiring any as-needed pain medicine.
Because I was so pain-free, I felt like I was perfectly fine to lift up these weights, and I really had to remind myself that I can't lift up a 45-pound plate because I need to pay attention to my recovery.
Even if you can't eliminate narcotics, if you can prescribe less, it will really start to cut down on some of the major societal issues that we're having with opioids.
There's been some progress. The Centers for Disease Control has made a push to limit opioid exposure in chronic pain sufferers, particularly addressing prescriptions written by primary care physicians. But experts say a deeper cultural shift is needed.
We also have a low threshold or low tolerance for any discomfort or any feelings of ill-being, and that's unusual in a developed world.
Dr. Kenneth Candido is a pain medicine physician at Advocate Illinois Masonic Medical Center, where he treats patients suffering with back, neck, and headache pain, among many other chronic and degenerative conditions, constantly trying to reduce opioids for his patients, instead attempting to find the source of the pain rather than throwing drugs at the symptoms.
I think that the expectations need to be commensurate with reality. We're not going to eliminate most people's pain. We can certainly change the way the body responds to that insult or injury, or we call it nociception, but we're not going to be able to, in most cases, to totally eradicate what caused them to come to our attention in the first place.
Chronic use of opioids and addiction often begin with a legal prescription. That's why alternatives to pain control are so important. Now, that doesn't hold true for patients suffering with cancer pain or those in end-of-life care, where narcotics may absolutely be necessary.